I need to help each other in this same boat. So my name is Guo Liyuan. This picture shows Zhang Boli. He is 72 years old. He is academic of the Chinese Academy of Energy, president of Tianjin University of Traditional Chinese Medicine. This time, he established the Jiangxia TCM makeshift hospital. This is the first hospital that is entirely in the charge of TCM doctors. Another man is Liu Qingquan. He is master supervised chief physician, president of the hospital, and head of Beijing Hospital of TCM, affiliated with Capital Medical University. This time, the Jiangxia Mask Hospital, it is composed of 29 experts from upper first-class hospital in Tianjin, Jiangsu, Hunan, Henan, and Shanxi, include TCM, respiratory medicine, imaging testing, nursing, and other specialists. Fortunately, my friend Yang Shuanzhu, master of medical, attending attending physician, he joined their team. During the 26-day operation of the beginning, February 14, Jiangxia makeshift hospital admitted 564 patients, cured 392, and transferred the rest of the other hospitals. In this hospital, they applied comprehensive treatment solution, primarily use the 清肺排毒 decoction, complete by the 太极八段锦 and acupuncture treatment. This picture shows the 清肺排毒. The pharmacist choose some herbs from the box and mix them to use the patient. Some doctor and nurse teach the patient to do the 太极 and 八段锦. Lots of acupuncture doctor use the acupuncture therapy to help the patient to cure. Why I need to introduce the Jiangxia makeshift hospital? Because the result is a great success for they corrected 3 records. The first is no patient went into the serious condition from mild symptoms. The second is no one test positive again after recovery. The third is no medical staff were infected. So this epidemic, some doctors said the TCM was, is, and will still be the important weapon for mankind to fight the epidemic. So I am very glad to share the experience for you. Why the TCM can help people to curb from the COVID-19, because the foundation principle of the treat disease in the traditional Chinese medicine is to harmony yin and yang and boost immunity. As that in Huangdi Neijing, no ever qi could hurt you when you have the healthy qi inside. Namely, if one develops a strong immunity, they will be free from all negative external influence. So the key of the TCM treatment is to improve the human body's immunity, not just against the virus. So the common complaints and the common develop. Some people perhaps very interested for the acupuncture and the moist bathing. So I share some experience about them. Chinese Associate of Acupuncture moist bathing ensured no coronavirus pure acupuncture intervention guidelines share the treatment plan for the medical observe period, clinic treatment period, and the recover period. The last share the in solution period at home. So when you are still under the medical observation, you can choose the one of the three major group of the acupuncture. Each time you can pick one or two of them to acupuncture. Moreover, you should choose an appropriate point combination according to the corresponding symptoms and signs. During the symptom is serious, if the doctor can do the acupuncture, they can choose their points. This picture shows the period of recovery. Some acupuncture points can help you. And if you are staying in the home, you can use the moist bathing, choose their points. Each acupuncture point take about 10 minutes. And the plastic symptom therapy and the massage at meridians also can help people to recover. During we stay in home, perhaps we need to do some traditional medicine, traditional method to help we can recover situation. For example, Tai Chi and Ba Duan Jing is a good choice. Each day, 15 or 30 minutes. And we need to pay attention to adjust our emotion. Use some acupuncture, therapy, massage, herb, and perhaps drink some tea and so on. This guideline shows the food breath. If you have the herb, you can cook and use them. This picture shows the point of long meridians of hand tie in. if you have some cough and headache, you can choose this point to massage by yourself. And this is a spleen meridians. And this is the two meridians. This point is dietary, is very useful for some people have a fever. Okay. So altogether, we need to define the virus. Thank you very much.
Thank you, Dr. Wu. So now we will ask Director Ma, the chairman of the China Latin American Center, and Thomas from Brazil, the chairman of IBRACHINA, to officially open this conference. Please, Professor Ma.
Hello, everyone. Firstly, I would like to say thank you to all of you for your time and your concern to this pandemic situation. We all, take care of people in Brazil, and we concern your situation. So as the chairman of the Latin American Center at Beijing Language and Culture University, we would like to share our experience and help all the people to deal with the COVID-19 virus in Brazil. And we would like to use our resources and our relations to help all of you. And thanks, Professor Hector, Dr. Guo, to share your expertise. I think with our joint effort, we can control the disease, and we can help people to save lives. Thank you again, and thank you for your time and your effort. Thank you.
Thank you, Director Matt. And now the event will be hosted from Brazil, Sao Paulo. Hello, Thomas.
Hello, Hector. Thank you, Hector. Thank you, Professor Ma. I want to greet also Dr. Guo, Dr. Dexter, Dr. Padilha from Brazil, and Dr. Otavio. It's a great pleasure to have everybody here in this meeting. We want to know the experience of China according to the COVID-19 and the experience that we can share here also in Brazil. And let me introduce myself. My name is Thomas Law. I'm the president of IBRACHINA. IBRACHINA is a social cultural institute that has the mission to promote and integrate both cultures, Brazil and China. So it's a great pleasure to be here, Hector. And let's discover more about the Chinese experience. Thank you.
We have Dr. Chen or Dr. Dexter. I just want to make sure Dr. Chen is on the room now. Okay, so let's, so we have Dr. Chen and his presentation. Mike, good morning in China, good evening in Sao Paulo. So now you need to set up your audio and make your presentation. I think your audio should be on, okay? Your audio is off now. Please turn on your audio.
I'm on, right?
You're on, yes. Go ahead.
Okay.
And I just remind everyone that we're being broadcast by the Facebook and YouTube channel of IBRACHINA, and I also understand the Brazil Bar Association. And also, we thank them for this broadcast, as well to the Casal Català TV and radio channels that are broadcasting not only for Brazil, but also for all over the world. Thank you so much. Go ahead, Mike.
Good morning, doctors and professors in China side, and good evening in the Brazilian side. Very nice to meet all of you. Today, I'm talking about a high tech for the COVID-19 is cell therapy for the prevention and the treatment for the COVID-19. I'm Dr. Mingwei Chen. I'm a doctor, is a medical doctor, and also the PhD in the US. So today I'll talk about this very briefly for this 7 different area actually today, because the time is limited. So just briefing through this. So just keep with me. So why do we need to boost the immunity? There's an article in the recent issue of the New England Journal of Medicine analyzed a total of 8,910 hospitalized patients with the COVID-19 from 169 hospitals in Asia, Europe, and North America. Out of those patients, 8,395 recovered and discharged, and only 515 died. So that's like 5.8%. The mortality rate was 10% for those who was over the 65 years old, and only 4.9% for those under 65 years old. Here has 4 different mortality. The first one, the mortality rate was 14.2% for those with COPD, and only 5% is otherwise. And the mortality rate was 10.2% for those with CAD, and only 5.2% otherwise. And the mortality rate was 11.5% for those with arrhythmia, and only 5.6% otherwise. The mortality rate was 15.3% for those with heart failure, and only 5.6% otherwise. So from above the statistical results, we know that the main reason of the deaths caused by the COVID-19 was a basic diseases and a lower immunity. Therefore, it is very important to boost our immunity. So here I'm talking about the NK cells prevent the infection of the COVID-19. From this graph, actually, there's a relationship between the NK cells and the immunity and infections for human whole life. This research published many years ago. So the blue line, blue curve, that's our immunity lifetime. And the orange one is an NK cell. NK, that's a natural killer cell. It's a ability and it's a curve. And the gray curve as represents the infection disease or cancer in our lifetime. So from this graph, actually, we can see if we can keep our NK cell in a certain higher level, so the disease infection will be keeping a lower level. So what is the natural killer cells? Probably many doctors knows, but I just say that. NK cells are the most important fighter, which is responsible for cleaning in our body for the abnormal cells, such as the aging cells, microbial or tumor cells, and also actually against the virus. And the amount of NK cell in our body is relatively low, and also the it's the activity and the numbers of NK cells decrease when we are getting older. So how to boost the immunity by the NK cell? Actually, just simply supply the exogenous NK cells to maintain the dynamic balance of the endogenous NK cell bank in our body and maintain its normal activity. Sounds very easy, but it's not that easy. So as the NK cells prevent infection COVID-19, apply the NK cell therapy to the people who are not infected by the COVID-19 yet. So in this stage, we don't need vaccine to prevent. We can use the NK cell instead. It's a very good news. And also, I'm talking about the stem cell to treat actually the COVID-19 here. So what is the stem cell? Stem cell is a group of a primitive cell with unlimited self-renew capacity. That's the first character of the stem cell. And also potential for directional differentiation. That's the second character. So mechanism of stem cell therapy is synthesize and secrete the cytokines and can against the virus, and also adjust the immune responses in a controlled manner. And also the synthesize and secrete many vascular and tissue growth factors, promote the recovery and the reconstruction of damaged vascular and alveolar tissues. So the advantage by using the MSC, that's a machineal stem cell, reduce the usage of hormones, reduce cytokine storms, reduce the sequela for the recovered patient, and also, of course, improve the life quality of the patient. So here is a case study. So one published case study in China, the 7 patients were enrolled, and 1 mild case, and 4 severe, 1 critical. So single venous the MSC transplantation was performed. In this study, the significantly improved the lung function in all patients in 14 days, and 2 patients with a wild type, mild type, and 1 patient with a serious type was discharged on the day 10th. And all symptoms were disappeared in all patients in 2 to 4 days. Normal biochemical, the critical liver and the heart was reached. So here is the chest CT picture. On the top, you can see the January 23rd, no pneumonia performance was observed yet. On the 30th, so you can see the ground glass opacity and the pneumonia infiltration occurred in the both sides of the lung. The stem cell therapy was performed on January the 31st. So you can see that on the top is February 2nd, pneumonia invaded whole lungs. But on the February 9th, the ground glass opacity and pneumonia infiltration faded away. And on the 15th, so only little this ground glass opacity can be observed. So it's a very significant. I talk about very briefly, it's a basic procedure for the stem cell therapy. Actually, for the immune cell, similar. So first, we take the umbilical cord or the blood as a raw material. Then we extract the stem cell and the culture and amplify in the laboratory. Then we transplantation in the hospital to the patient, or the immunity for the people are not infected yet. So for this, right now the situation for this stem cell therapy in the world, it's already more than 500 stem cell treatments has been performed in China so far. And there's 36 trials of stem cell therapy for COVID-19 has been registered in the clinicaltrial.gov. Everybody knows that's in the world, every clinical trial has to register on this site. So it's among these 36, 13 in China, 10 in Europe, and 7 in the US. So actually it's a lot trial going on. Among these 36 trials, 33 use the MSC, 1 embryonic stem cell, and 2 use cord blood stem cell. So the conclusion sentence. The cell therapy is safe and effective for prevention and treatment of COVID-19. Thank you very much. If you are interested, any small topic, we can expand it. Actually, this speech I was prepared for 45 minutes, but I was told the time limit, so I just brief go through it. Thank you very much again.
Thank you, Mike. So go ahead, Thomas, and introduce the doctors from Brazil. I know Dr. Padilha and Dr. Otavio are ready with us. Go ahead, Thomas. And I just want to thank Luis Eduardo Vidal, a dear friend from Brazil, my classmate at Tsinghua University Law School. And we have a great coincidence. The Health Code of China was approved. And one of our professors was the leading lawyer for developing this. And I know we're some lawyers here with doctors. I think it's a good way to work toward very positive social change. Go ahead, Thomas.
Thank you, Hector. I'm glad to introduce our Brazilian doctors. First of all, Dr. Alexandre Padilha. He was a former Minister of Health in Brazil. He is a specialist in infectious disease physician. So he will be talking to us about the Brazilian experience. And also with Dr. Otavio Berwanger. He's a cardiologist and director of the clinical in Hospital Einstein, one of the largest hospital in São Paulo, Brazil. So Dr. Otavio, should you start?
I'll be happy.
Octavio is without the microphone.
Yes, can you hear me now?
Yes, Octavio. Just one question on Chinese side. Dorothy, how about your time?
I'm good. I'm ready.
Okay.
So it's okay if I present first, or I can go after Otavio. That would be fine.
Maybe ladies first. Dorothy would like to go first.
Okay. Thank you so much. So I'm going to start sharing my screen, and I'm so excited to hear what all of you have said, because I feel like we're all talking about the same language. It's how to make the body stronger so it can resist COVID. So it's not about having the number of testing kits, which I've seen all over the world. You just need to test as many people and get the vaccine. This is the goal, and this is a big term, a long, medium-term goal, but we need to make the body stronger to help fight COVID first, and hopefully the vaccine will be available soon. So I would like to talk about the role of primary care in COVID-19 prevention and treatment. And it's interesting because we're talking about what is known in China. And I was sharing some of this experience and evidence-based food that we should eat with my patients. And I was telling her, one of my Chinese patients, I was saying, how can I get this knowledge out to as many people here in China as I can? And she said, people know this already in China. So I really think one of the richest parts of Chinese culture is this ancestral knowledge of what to eat, what not to eat, how to stay healthy. And I think the rest of the world, we need to learn, because perhaps we were not raised with this inner knowledge or wisdom in choices. So I'm basing my presentation on the research that's been done by several universities in the US and in China and around the world. And it's an integrative medicine perspective. I'm a family physician in Beijing United Hospital here in Beijing. And I'm originally from Ecuador, so I really feel I can understand what Brazil is going through, because Ecuador is going through a very similar situation. And I've been very closely following, and it's interesting and painful. And there's lots of learning and lots of positive things as well. So I think it's important to keep everything in mind. So in the stages of COVID prevention and infection, it's important to know there's two phases. First, if we could prevent the person from ever getting sick, this would be ideal. And then once they get infected, hopefully they would not develop the pulmonary complications or the cytokine storm. So these are two phases in which we can act. So in the pre-infection, of course, this is a huge opportunity. If we can keep people from getting the virus, this would be our best intervention. And then once they get sick, hopefully their immune system is so strong that they don't get the cytokine storm or the lung complication. So how to limit exposure? I think this is very complex, especially in countries where there is no order. From a cultural level, people don't obey. If you tell them to stay home, they say, no, why should I stay home? From an administrative level, if the government doesn't agree if people should stay home or not. So it has this very multi-layered characteristic. So one thing that I thought was very useful here in China is the clear establishment of fever clinics. We must have clinics that see all patients, like the baby who needs a vaccine, the back pain patient, and these patients should not meet up with the COVID patient. So the way this was done in China was clearly establishing a fever patient clinic and other patient clinic. So no one can even set foot in the clinic I work at if they have a fever, because it's a primary healthcare setting. And we always tell our patients, if they call for an appointment, if they come up to the door, we tell them you need to go to the fever clinic if you have a fever. So I think this is key. And of course, there's this culture of using masks from previous experiences with MERS and SARS in China. So people already know the mask is the thing to do. And I think there's less controversy on this, but still I was checking, and as you check online, there are many resources. Some of them say use a mask, some of them say don't use a mask. But I really like this study that was published in the BMJ by one of my friends, actually Dr. Javid, who worked here in Tsinghua University for many years. And so he's saying, yes, this is a benefit and there's no harm. So please wear a mask. Then of course there's the use of soap and disinfectants. And another point that I would like to emphasize is the importance of meeting among the authorities, because perhaps the instructions we gave last week are not very meaningful the next week. So we need to keep meeting and have daily meetings and change our perspective perhaps if needed. And we must have trust both ways. We must trust the population must trust the government. If there's trust, we can fight COVID. Now I'm going to go on with fighting the virus through having a strong immune system. So this is interesting. It's how people were sleeping during COVID, and guess what they found? Not very well. Especially young people were having a hard time sleeping. And I think it's perhaps this is so big, it's the biggest crisis we've ever lived. So they felt more distraught, more confused. And they also found that medical professionals had very poor sleep. So considering how exposed medical professionals maintain our natural killers and all these defenses, we really must emphasize the healthy sleep. So a few tips on sleep from Dr. Ruben Naiman. We must wake up and go to sleep at the same time every day. We must get light during the morning. We must use our bed only for sleep, not for work, not to look at our phone, not to think about anything else. We must get out of bed if we can't sleep and only go back to bed once we're able to sleep again. We must avoid alcohol, nicotine, caffeine, sleeping pills. And this is very important because the increase in addiction to alcohol is alarming, considering how harmful this is for our health and also for our sleep. And then the use of melatonin is a very safe supplement that can help people sleep better when they have conditions that have decreased their melatonin levels over years, like being awake all night, this, or looking at our computer up into late hours of the night. This will decrease our melatonin synthesis, so we should take it. I'll talk more about this later. And then practicing mindfulness before bed, this is amazing. So you just shut off your brain by breathing or by thinking about the present. And this is a great handout from the University of Wisconsin. I loved it because I was trying to find a slide that talked about the importance of eating the right things, and then I found a slide that has everything in it. So the website is at the bottom, and we can share this with all our patients. So it tells us what they should eat, what they should avoid. And at the top, I like because it also says be active, manage your stress, get sleep, spend time doing things you love with those you love, and manage your weight. So it's a very complete how to reduce inflammation in your body. And now a little into the science about preventing the actual entrance of this virus to our cells. Of course, this is mostly based on research that was done in the lab because COVID is not so old. So we don't have long dated research. But what this research shows is very, very important, and I think it can be applied into our daily practice and our recommendations for our patients. So first thing is that vitamin D is one of the most important parts of our immune system. And this, all of us, if we've been in lockdown for 4 months, our vitamin D, I'm sure, is not perfect because we get vitamin D from the sun. So we must tell our patients to take vitamin D supplements and to try to get out into the sun at least 1 hour every day. And I'm sure Dr. Otavio knows about this as well, how important vitamin D is for heart health. And so not only the immune system, but our whole body, our brain needs vitamin D. And so I like this study because they actually were brave enough to put a dose in. Usually they don't say how much you should take because they're afraid of offending someone. But in this study, they said during COVID times, we recommend people take 2 weeks, 10,000 units of vitamin D per day, and then follow up with 5,000 units of vitamin D after that, and check their blood levels to make sure they're not deficient. Now, this is a plant that will prevent attachment and replication. I'm not sure if you have this plant in Brazil, but I'm guessing you do because we have it in Ecuador. So it's called sauco or tilo. And this is amazing because it really works. It helps prevent viral attachment and replication. And this has a grade A level evidence for preventing influenza. So we still don't know in COVID, but in influenza, it has very good research. This is a beautiful plant as well, very common here in China. This is one of the things people here just know because they know for cultural reasons. Huangqi or astragalus is very good at preventing viral attachment. And the other day I went shopping, they had it in the mall right on the shelf. You could buy some astragalus to use every day. Another very important supplement that you can also get in your food if you eat oysters or seeds or nuts or whole grain is zinc. And if you don't get enough through your food, you can take 20 milligrams a day of zinc. And this is amazing because it prevents viral replication within the cell. So if anyone is sick with COVID, they should take zinc supplements. And then a little, when someone already is sick, what can we do to prevent this from getting into the lung, causing severe infection zone? The NLRP3 inflammasome is a signaling platform. It's responsible for the overactivation of the immune system. So what can we do? They found studies in mice finding the exact link between the NLRP3 inflammasome, and if they inhibited it 3 days after the infection in these mice, then there was a decrease in the inflammation without decreasing the viral elimination. So this is what we want. We want something that'll stop the inflammation without stopping the immune system. And then NFKB inhibition also improved survival in mice with coronavirus and had respiratory syndrome. So what are the inhibitors of NF, of the inflammasome? We have vitamin C, and this they have used in many ICU units. They use it IV and orally. I believe patients can take 2,000, and it's important that they drink lots of liquids. And some people get gastrointestinal disturbance, so they can regulate their dose, and this will help with the process in the body. And it's been studied, and there's this huge review of human studies that shows that vitamin C is helpful in decreasing the common cold. So melatonin, as I said before, not only will it help you sleep, it will also decrease the inflammation of the NFKB. And so by this, it will reduce the likelihood of you getting pneumonia. So if you can't sleep, take melatonin. The dose 0.8 is enough. Most ones you buy have like 3 milligrams, but all you need is 0.8. And now flavonoids. This is amazing because any country you go to, you can buy flavonoids in your market. How do you know it's a flavonoid? Is any fruit or potato or leaf that has color. So where are the flavonoids? There are more than 4,000 edible flavonoids in the world. We can eat them all. And what will they do? They will decrease this inflammation and all the signaling of this inflammatory platform. And of course, you can buy it in supplement as well. Quercetin, I love this one because everywhere in the world you can get onions, right? Even in the tiny store, in the tiny town, you can find an onion or an apple, hopefully. And so this has a potent anti-COVID effect. First, it doesn't let the COVID into the cell, and it also helps the zinc in. And what's interesting, they found that this and hydroxychloroquine have a similar action. They're both ionophores, so they both increase the entry of zinc to the cell. So I recommend everyone increase their onion intake. Garlic, again, a great part of Chinese culture is eating lots of garlic. And this has a great role in activating the immune cells and also decreasing inflammation. And green tea, everyone has seen people here walk around all day with a jar of green tea. And it tastes great once you develop the taste for it. So green tea has a very, very anti-inflammatory effect. If anyone is sick with COVID, they should be drinking green tea. And turmeric, which is a spice from India that's very rich in flavonoids, this will affect both the viral adhesion, entrance, and replication. So turmeric is a very good spice. We can take it also as a supplement if we want 2 tablespoons per day. And now onto my favorite part of all this, because we always talk about what we should eat, but perhaps the best solution is just not to eat. So we're in this culture of eating and eating and eating, and now more if we're home all day, right? So I love the fact that they found that through fasting, we produce this fatty acid called beta-hydroxybutyrate. And this fatty acid actually inhibits the inflammation. So what a better solution if we're under economic crisis and we don't have enough money to buy food. Why not help our patients feel that the best thing they could do for themselves is to actually limit how much food they're eating to a certain time of day, perhaps only eat during daytime, only eat 2 times a day. And if you can do 16 hours of not eating, this would be great. So you go to bed, you don't have any breakfast, and maybe you start your day with a 12 o'clock breakfast, which many people are doing already because they're staying up so late at night. So the change would be just don't eat up into the late hours of the night. And then an alternative that I think may be more popular with some people to fasting is this fasting mimicking diet, where you feed your body things similar to what it would be burning if it were burning your reserves. So you eat plant oils that are anti-inflammatory, like olive oil, avocado, coconut. And you eat vegetables like broccoli and cabbage and onions. And you make salads or soups, like vegetable soup would be great. And so what you do is for 5 days, this is how they used it with cancer patients. They gave them 5 days of this food where there's 1,000 calories per day. And they found that cancer patients had a much greater survival. And I think it's all linked to what Dr. Chen was talking about, the NFK, the natural killer cells. So when you do a period of fasting, your immune system primes up and it actually activates these super cells that are in the umbilical cord of babies. It activates them within your own body and helps them replicate. So fasting turns out to be not such a sacrifice, because you're sacrificing maybe 1 or 2 meals a day, or maybe 2-3 days without eating all that you would want. But in fact, you're boosting your immune system. So who should not fast? It's people who are pregnant, breastfeeding mothers, children, and then if anyone is very thin, like their body mass index under 18, they should not fast. But anyone else can fast. It won't kill them. It'll be fine. Their body has reserves to live for like 2 years if they don't eat. Sorry, I'm exaggerating, but 2 months at least. And basically, it's something that we can tell our patients to do that won't add any cost to their existence. Like if I tell them to go buy melatonin or go buy some apples or berries, maybe they don't have the money for it, but everyone can afford a fast. So this is the good thing about fasting. And also it's the results in diabetes and cancer and cardiovascular disease are just mouth opening. Amazing. So now my last tip will be on maintaining a healthy immune system through stress management. So I really love this well-being coach because it includes all these aspects like nutrition, sleep, resilience, environment, movement, relationships, and spirituality, and how all these core values are important. So this is from the University of Arizona Integrative Medicine. They have this app for free as well. We can recommend it to our patients. And then another tip that really has come up, I've been doing some talks for Ecuador, and my doctor friends were saying, please, Dorothy, can you prepare something on addictions? Because this is such a big problem now, drug addiction, alcohol addiction. So I was so interested to find, and the next talk I will prepare for Ecuador will be about that, is how there's certain acupuncture points in the ear that can help reduce the craving for certain drugs. And also there are these phone apps that were created by Judson Brewer, who has 20 years of research on how to use mindfulness to heal addictions. So I encourage you all to check out these resources. And then my final message to everyone and to myself is always that altruism switches off thoughts of fear and turns them into love. So whenever we're feeling afraid, we can get up and do something, and then the fear will go away. So this is also a message we should share with our patients. If we see they're too anxious, too worried, we can say, well, who do you think you could help? Where do you think your help would be needed most? And so thank you very much, Hector, for this invitation and for everyone who's here today. And I can't wait to hear your presentations from Brazil. And these are some online resources that I'd like to share with you all. The first one is the website, has lots of resources for COVID-19, the Integrative Medicine Arizona website. The second one is has primary healthcare handouts for patients, and they're beautiful, about insomnia, about exercise, about obesity. So I really recommend you use these. And they're in English and Spanish, so it could be useful. And the last is a website that we're generating to put all this information on. So thank you very much.
Thank you so much, Dorothy. Dorothy Dexter from Ecuador now, family doctor at Beijing United Family Hospital. Thomas, so thank you so much to Director Octavio and Minister Padilla. We are very eager to listen to them.
First of all, I want to congratulate Mr. Chen and Dr. Dexter for their presentation. And now, should we start with Dr. Otavio or Dr. Padilha?
It can be Otavio. It can be Otavio. Go on.
Otavio. Okay, Otavio, you have the word. Dr. Otavio is director of the academic research organization at Hospital Israelita Albert Einstein in São Paulo, and is very famous in Brazil.
No, not famous, but a great pleasure to be here. So thanks very much for the honorable invitation, Thomas. It's a pleasure to be with the colleagues from China. I've been to China 3 times, and was some of the best trips I ever made. I collaborate a lot. I'm a clinical researcher, so I collaborate a lot with China. Always been great to interact with you, and congratulations for the great presentations. Congratulations for this event. So I'll try to share my screen here to present some slides. So allow me just 1 second. Presentation should open in a few seconds here. Hopefully we'll be able to see them, the slides. Yeah. Okay, can you see my screen?
Yes, it's very clear.
Okay, thank you very much. So I'm a cardiologist by training and a clinical epidemiologist, and I work conducting clinical trials and doing clinical research and epidemiological research. And I think one thing I would like to highlight, and I will start by just highlighting the importance of evidence-based medicine and sound methodology. And after I'll give some examples of clinical studies and clinical trials that are ongoing in Brazil in order to maybe provide some answers to the best way to treat these patients. And the first thing that I'll like to highlight is, of course, I think since World War II, this is probably a moment that challenged several generations here. Probably none of us have ever faced such a big crisis and a big challenge. And this crisis goes beyond health. It has a lot of impacts on our society, on political issues, on economic issues. So it's truly a complex situation. Of course, people are very anxious and concerned on what's coming next. Every 24 hours, things seems to shift. And the problem with situations like that is that sometimes we seek simple answers to a very complex problem. And sometimes the simple answers can be wrong. And this goes once again beyond just healthcare and beyond research. But in order to address this problem, and now I'm talking about in terms of healthcare, we really need to study properly the interventions. And I'll give you an example here. Of course, it's very different because it wasn't a pandemic. It was a very serious disease, but concentrated in one country. But if we remember the Ebola outbreak 6 years ago, almost 30,000 individuals developed Ebola. And if some of you remember, a lot of these interventions was proposed as potential solutions to treat Ebola: chloroquine, hydroxychloroquine, favipiravir, monoclonal antibodies, convalescent plasma, and many others. I think you all heard of these interventions right now as also potential solutions to treating COVID-19. But unfortunately, by that time, none of them was proven to be safe, and none was proven to be efficacious. And why is that? Of course, there are several reasons, but one very important reason was due to the fact that we could not conduct the proper studies testing them. And one of my main concerns, there are two sides which I'm seeing in this crisis as a researcher. One, it's more and more people are interested in clinical trials and clinical research and results. This weekend I went downstairs in my house and I saw my two neighbors, two old ladies, discussing about chloroquine, whether it works or not. And I never seen that before. I mean, lay people discussing about therapies, about research. So that's good. So people are understanding that research and investment in research is something that we need. On the other hand, we're seeing a lot of fake news being. Just a second. Sorry about that. We're seeing a lot of fake news being, shared in social media, etc. A lot of papers being published as preprint, and people takes that as truth, and that's a big problem. But and one of the big problems is that people start using the interventions, and we cannot do the proper studies to test them. And we need the proper studies to test these interventions. We cannot move away for the pathway of science. What I would like to make it very clear is the only way to get out of this crisis is through science, to serious and ethical science. And of course, I know that not everyone who are watching us are healthcare professionals, but I just want to call to your attention that this is the type of study that will provide us the right answers. The randomized trial. The randomized trial was created in 1948 by a guy called Bradford Hill. He was a statistician in London. And this is the only way to truly define whether a drug works or not, whether any intervention works or not. And why is that? Because randomization creates two groups which are well matched for known and unknown characteristics. So you create two groups that are absolutely equal, the only difference between them being the treatment. So if I want to say that hydroxychloroquine or convalescent plasma or any other intervention works or not, I need to put this patient in a randomized trial and compare an equal group of patients. Half of them will receive, half of them will not receive, or will receive different doses, whatever, depending on the design. And I will follow these patients up. Given that they were well matched for other characteristics, if one group has a better evolution than the others, better outcomes, I can attribute this better evolution to the intervention. So it's only through randomization that we can say whether something works and something doesn't work. And especially when we have studies which are large studies that are measuring important outcomes for patients like mortality, need for mechanical ventilation, length of hospitalization, quality of life. If we are measuring this type of outcomes, then we can be sure that the therapies really work. And what we're seeing is that people are let's use that. And then all of a sudden there's a protocol and everybody started using some drugs, and we don't have data on safety and on efficacy. And that can be very dangerous if we start using something that we don't know if works or not. And more than that, if it can cause some harm. So it's much better to conduct the proper trials than to start using things with a lot of uncertainty. When we have uncertainty, the most ethical way to treat a patient is through a clinical trial. And why I'm saying that, and that has a lot to do things that are being shared in social media and in fake news. If we look at, this is a very interesting publication, and they're saying that the likelihood of some types of research of being false. So if someone comes up with something which is a magical solution that cures everyone, that is fantastic, the chances of that being true is 1%, is 0.1%. It's 99.9% of chance of probability that that is not true. When we have observational studies, as we are seeing right now, they can be true, but it's still the likelihood of the findings being confirmed is only 20%. When we have a well-done randomized study, this type of study that I just mentioned, then the likelihood goes to 85 to 90%. So that's the way where we can find therapies. So of course, when we're talking about therapies, we don't need randomized trials for everything. I mean, in terms of diet, well-being, and etc., there's no harm, the opposite. So of course, we don't need to do large trials with that. We can, but we can use these interventions. But when we're talking about drugs that can cause adverse events, we need to do the proper studies. That is a must. That is something we cannot forget. We need the pathway of science. There's no other pathway than science. And sometimes people get very excited. We have a small study which is not published in a peer-reviewed journal, is in a preprint format, and all of a sudden when there's a super effect, and people like what we call the statistically significant effect. But once again, if we go back, depending on the type of research that you have, there's a high chance of these findings being false. So we must be aware of that. And that's very important. And we learned this lesson before in other areas, in my area, cardiology, in several other areas. And sometimes we think we are doing the best for our patients, the best for our society, but we are not looking at the environment, and the environment can be dangerous sometimes. So I'm really, once again, I'm really happy that our society, that lay people are interested in the results of clinical trials and whether these drugs work or not. This is a very positive thing. I think now people realize that investment in research should be a priority. On the other hand, it's very easy for people to take some truths which are not exactly correct. Once again, coming back to the easy answers part. So in terms of pharmacological therapy, as you know, a lot of drugs are being proposed as potential solutions. So that's good. That's good. But we need to test them, and we need to use them properly in randomized trials. So we have a lot of drugs like IL-C inhibitors that can prevent cytokine storm. Of course, chloroquine and hydroxychloroquine ended up being something which goes beyond science. And I think it should, at this moment, be restricted to science, to clinical trials. And we have antiviral drugs. So there are several drugs being proposed as useful. That's good. That's not a bad thing. That's wonderful. But once again, we need to test these drugs properly. Some of the results that we have so far, and then and in the end, I'll show you very quickly what we're doing in Brazil. But we have some trials of lopinavir, ritonavir. Results, this was not a very large trial, so still there's uncertainty about this drug. The most promising drug so far seems to be remdesivir. We don't have it in Brazil yet, but at least we have one randomized trial that in which we observed the clinical improvement. This trial was early stopped for benefit, but actually the main effects were on median recovery time as compared to placebo. So that's the best randomized trial we have so far. We still have a lot of questions about this drug. There's a lot of cost effectiveness issues, but at least we have a proper trial testing this drug published in a high impact journal. And one important thing, why we need to randomize, why we need a control group, and why we need comparison, is that people tend to interpret drugs that way. If my patient dies, or if he needs mechanical ventilation, his outcomes are not the ones we expect, we tend to say, oh, that's because of the disease. The disease progressed. Unfortunately, the patient did not go well. If I prescribe them a therapy, any one of the therapies that I just showed you, I said, and the patient got better, I say, it is because of the therapy. So when you don't have a control group, you always say, good outcomes is because of the therapy, bad outcomes is because of the disease. And this inference can be false if you don't have, once again, a proper comparison. This is what I mean. So I've seen a lot of experience. So we are using here in our ICU and all the patients are getting better. But wait a minute, what would happen if we're not using that? So we don't have the comparison. That's why we need the science, we need the studies. This is very important. And then we come to hydroxychloroquine together with azithromycin, and we've seen some studies in preprint suggesting a great effect in terms of percent of patients who ended up with PCR negative samples. Small study, weak methodology, but all of a sudden that became bigger than everything else, and it became something that has been discussed beyond science. It is what it is right now, but once again, I think our discussions should be within science. That's the only way to know whether it works or not. And we have a lot of important contributions from China also, and we have a lot of small studies testing hydroxychloroquine. And then we come to some observational studies. As I mentioned, observational studies are interesting. They are interesting to generate hypotheses, but they are not enough to define whether a therapy works or not. Observational studies is how the drug was used in practice. It's different from a randomized trial. So we know that, for example, hydroxychloroquine in association with azithromycin can cause some problems in terms of the cardiovascular system, in changing the QT interval, and that can cause some arrhythmias. The observational studies we have published in the New England suggested no effect, but once again, it doesn't mean it doesn't work. It just generate some hypotheses. And we also seen similar results published in JAMA with hydroxychloroquine together with azithromycin, but once again, observational study. And finally, the trial that was published some days ago in Lancet and is generating a lot of controversies, a lot of criticisms in the way the authors handle the analysis. So we still have uncertainty. And then a lot of societies are suggesting that we use these drugs in the context of clinical trials. So instead of using them in practice, patients will be better served if we use them in the context of sound clinical trials. And for example, Infectious Disease Society of America, societies here in Brazil are saying the same. The NIH also suggests that instead of using them in any patient in clinical practice, it's better if we use them in clinical trials, because in the clinical trials, we will definitely know whether it works or not. We'll guarantee that patients will follow a protocol, the right dose. These trials will be followed by independent data safety monitoring boards. So we can assure that patients will follow properly. And to finalize, this is what we're doing in Brazil. Brazil, we did a coalition of several institutions, Albert Einstein together with other institutions, as you can see here. So this is a joint effort to conduct the proper randomized trials in the country. Everybody's equal. Everybody is trying to do the effort. Right now, this coalition has about 100 sites participating in Brazil, public and private hospitals all over the country to conduct large-scale randomized trials. We just finished 2 trials, 2 in hospitalized patients testing hydroxychloroquine and hydroxychloroquine together with azithromycin. These trials are complete. Results should be available very soon. We have 1 in patients hospitalized with moderate severity. Sorry, this is in Portuguese, but I'll just read it in English. We have 1 trial of hydroxychloroquine and azithromycin in patients with severe disease. We'll know the results very soon. These are large studies all over the country. We have a trial being finalized with corticosteroids for patients with a very severe condition, which is called ARDS. in patients which are in the ICU. And we have other trials. We have a trial starting with anticoagulants. We have a trial in outpatients, patients who are not hospitalized, testing hydroxychloroquine or placebo. We have a trial with tocilizumab. So, and we are starting trials with other drugs. So we have trials with convalescent plasma. So what we're doing in it right now, it's in almost 100 sites in Brazil. We are conducting the trials, and we'll let the science provide us the answers that we need. I think that's my last slide, and I would like to thanks very much for your attention. I'll be available to any discussion that may be needed. Thank you very much.
Thank you so much, Dr. Octavio, for your scientific presentation. And we have now it very, very clear. Thomas, and Minister Padilla also is with us. Well, we really want to thank him. Normally in China, the minister will go first, but he has been very humble and let us have all the doctors from China due to the special circumstance that some of them need to go back to hospital. So thank you, Minister Padilla. Go ahead, Thomas.
Okay, so I'll introduce Minister Padilha. Alexandre Padilha, he was former Minister of Health in Brazil. And he's a specialist in infectious disease and physician. And nowadays he's a federal deputy in Brasilia, in the congressman. So you have the word, Dr. Padilha.
I think it's my phone. Okay,
Yeah,
I'm just trying to share the presentation. So I'm just looking for here. How can I put the whole screen? I'm just looking for. I'm trying
Hi, Padilha, you can press the button present.
Yes, I'm just looking for it.
It's in the
slide.
Padilha, tá no lado superior direito. Tem botão amarelo chamado share. Ali tem present.
I got it.
Yeah.
I got it. Okay.
Okay.
Thank you. Thank you very much, Dr. Law. I'd like to extend my thanks to the IBRACHINA, the Brazil and China Institute, as well as China's partners who will be able to share with us their experience of facing COVID-19. I was just remembering when listening to Dorothy and to Go, my last visit to China as a former minister, it happened in 2013, and I could be able to visit the National Eye Institute, which was very interesting because in the same big hospital, sharing the experience of traditional medical Chinese and the most advanced Occidental medicine in ophthalmology. So I was very impressed. So I was just remembered that, listen to Dorothy and Gu talking about the traditional Chinese medicine. And I've already been presented. My name is Alexandre Padilha. I'm an infectologist here in the University of São Paulo. I'm still acting as a university professor and following patients, even though I have been member of the Brazilian National Parliament since 2019. I've been the Minister of Health of Brazil from 2011 to 2014, as Law has already presented. So I worked during the H1N1 pandemic in 2009, I was Minister of Political Coordination of Brazil, so I followed the actions of the National Health Ministry and regional and local governments at that time. At the end of the 19th, I coordinated a unit of my University of São Paulo in the Amazon region, which is another region of Brazil, far from São Paulo and the north of Brazil. So I coordinate there the malaria control program. So therefore, I want to exchange experience of the Brazilian reality from those has already have experienced the facing of other epidemics in Brazil, whom I'm following the reality of patients and communities, still visiting patients in the hospital, and as who is today is in a political position in the parliament, I'm trying to monitoring, supervising the actions of Brazilian national government. So I try to share a more political view and epidemiological situation of the epidemics in Brazil. Brazil is today the epicenter of the pandemic of COVID-19. This data is from June the 1st that indicates that we are already the second place in the number of cases. We now occupy the fourth in the total number of deaths, and we do not even start our winter period. So we probably will progress in number of cases and deaths in our country. In addition to this very worrying position of Brazil in relation to COVID-19, with points that probably the United States and Brazil will be the two countries with the highest number of cases and deaths from COVID-19 in 2020, I would like to point out that Brazil continues to have these numbers in scenario of very low testing. We are the second in number of cases, we are the fourth in the deaths, and we are the 125th in the number of tests per million inhabitants. Basically because the federal government has not prepared the country for a policy of mass testing in Brazil. Recent studies over investigation of deaths, records of hospitalizations due to severe acute respiratory syndrome, and serological surveys conducted in Brazil revealed, among other aspects, that we should have 7 to 11 times more cases than confirmed ones, and 35 to 65% more deaths among those registered. This slide clear reveals, sorry, let me change the slide. This slide clearly reveals the severity of pandemic progression by COVID-19 in Brazil. We all know that the underreporting of confirmation of deaths in theory exists is lower than the underreporting of cases. That it's comprised by the population of a given territory, in this case of a country, allow us a better assessment of the severity of that pandemics for that country. In this graph, we compare the daily evolution between Brazil and the United States regarding the number of deaths confirmed by COVID-19 for every 1 million inhabitants. In it, we can see that Brazil, from May 22nd, began to land more deaths per 1 million inhabitants than the United States. And this trend remains to this day. And I would like to point out that we have not yet started our winter. This points to a situation that Brazil will achieve more deaths than the United States of America. We don't know yet. We don't know yet. Our population is smaller, and the share of our population in tropical climates much larger than the United States. However, we will most likely to have more deaths per 1 million, which reveals a great severity of the pandemic here in Brazil. I'm gonna show another slide so can be faster the presentation. In this sequence of 3 slides, I will show the evolution of COVID-19 as a cause of death in Brazil compared to other causes. In blue, excuse me, in Portuguese, in blue we have cancer, in red COVID-19, yellow is cardiovascular disease, green is strokes, in purple flu and pneumonia, and light brown diabetes, in dark green physical aggressions. So the first case of death of COVID-19 in Brazil was reported in early March, just 30 days later from this first report. COVID-19 was already the 3rd daily cause of death in Brazil. This second slide shows that COVID was the second cause at the end of April, and the first cause in the early May. Over the entire course of May, COVID-19 consolidated itself as the first cause of daily deaths in Brazil. So I'd say that nothing kills more than COVID-19 daily in Brazil nowadays. Since the end of May, no country in the world dies more than COVID-19 daily than Brazil. I will share with you this a slide that can show the special distribution of cases and deaths, territory distribution of cases and deaths in Brazil. Many of our specialists, epidemiologists, infectious disease specialists, at the beginning of the pandemic in Brazil, they believed that COVID-19 would have a kind of a spatial distribution, a concentration of cases and deaths very similar to the H1N1 pandemic in 2009 and 2010, which were strongly concentrated in the southern states, which are the colder states, in the southeast regions, which are the more populous cities where São Paulo and Rio de Janeiro are located, for example. However, COVID-19 is distributed throughout the country, as you can see, in the south, in the southeast, northeast, and the north, not only in the southeast regions or the southern regions. This slide is from May 18th, where 60% of the cities, municipalities had already registered at least one case of COVID-19. Today, about 80% of the municipalities already have at least one case. Although it's still concentrated in the urban regions of large cities, however, with a growth for the urban regions of medium and small cities, very closer to the rural region. In addition to the territorial extension of the pandemic, this growth to the small cities is worrying because it may mean reaching vulnerable populations such as indigenous populations and some regions with even less medical supply and health service. I think that there's, in this slide, an important difference in relation when comparing the H1N1 pandemic in 2009, because on that occasion, the case rose in Mexico and the United States in the late April and early May, arrived in Brazil in June, in the Brazilian winter, that most strongly affects the South and Southeast region. However, in the Amazon region, in the north of Brazil, and the north of our country, the climate, the weather is always warm. So the Amazon winter, it's the rainy season that takes place in the period of February to April and May. So in 2009, H1N1 pandemic had arrived in Brazil after this period. It has arrived in June. In 2020, COVID-19 arrived in Brazil exactly in the so-called Amazon winter, which explained the higher incidence of case and mortality in the major cities of this region, like Manaus, Belém, and Macapá in the north. The largest national serological survey conducted in Brazil, it has been coordinated by the Ministry of Health, conducted in the third week of May, revealed about 3% of infected population in large cities in the southeast region, such as São Paulo and Rio de Janeiro, and about 3% in large cities in the northeast regions, such as Recife and Fortaleza, and at about 10 to 20% of the large cities of the Amazonic regions, such as Manaus and Belém. I think this low infected population proportion revealed the still very high amount of susceptible people in Brazil, and it shows the size of the challenge and the risk of measures that are already being announced in several regions by local and regional governments of opening urban, economic, and commercial activities, so promoting more people circulation in the big cities. The major concern of any country in COVID-19 is the collapse of its health system. In Brazil, it's no different as our main concern at this moment. This table shows the proportion of ICU bed occupancy by COVID-19 reported by the states' health departments during the last week of May. It shows that more than 70% of the ICU beds in the public network are occupied by COVID-19, resulting in non-hospitalization for other important causes such as surgeries, cancers, etc. The health system in Brazil is quite hybrid. Although we have a universal public national system for the entire population, about 25% of the population has private access to private plans that in their largest majority of those plans give access to private ICU beds in COVID-19. About half of these ICU beds available in the public system, about half of these ICU beds available in Brazil are in the public system, and the half of the other beds are exclusive for this 25% population that have private plan. Just information, more than 60% of the public ICU beds in the public network were opened in the period of 2009 up to 2015 after the H1N1 pandemic. Since 2016, this progression being stopped. At this year to 2020, a small emergency volume of ICU beds has been opened, and there are two strong limiting factors nowadays to the opening of new ICU beds in the public system. The possibility to have equipment, mechanic ventilation equipment, and professionals, skilled professionals to work in the ICU beds. I'd like to address what I would say 6 more general challenges that I consider to be important for us in Brazil, considering those 6 challenges as kind of opportunities in the relationship with Brazil and China, as our colleagues have presented here. The first big challenge is that Brazil is now experiencing a critical moment in the pandemic of the COVID-19. A number of issues of this critical moment related to the severity of COVID-19 itself, as observed in several countries with a stronger economic, social, and greater developments than Brazil. Some of the aspects are specific of our Brazilian condition, for example, social vulnerability, poverty, housing and transportation conditions in cities, weakness of our health system. But at this moment, it's already internationally recognized that the message of the national political leadership, as Otavio has told, the head of the state of Brazil, and the kind of struggling between the national leadership and local government and health specialists, even the health ministry. We have dropped 2 health ministers in the middle of this big crisis, has been a very destabilizing factor of the Brazilian response. In the sense, the national parliament sought to establish a kind of a permanent commission for seeking consensus with parliament, or with members of the parliament from various, several political sides, from the several regions of the country, all of them with a good experience in health management, to try to monitor and propose some measures to the national authority, to the national health system. This commission has established a permanent panel of experts trying to discuss in the light of scientific evidence, as Otavio told, about the various issues that is struggling and facing this critical moment of the pandemic in Brazil. Even the discussion about how to achieve vaccines and pharmacological therapies, how they can be accessible for the population in Brazil. I'd like first to reinforce the suggestion that the Institute, IBRACHINA, and our partners establish a permanent relationship with this Parliament Commission, of which I'm a member, in order to comply with the decisions of public policies and opportunities for cooperation that can be driven or affected by those political decisions. The second challenge, I would say that Brazilian people have for decades developed several ways to organize themselves in communities, especially in most vulnerable areas, learning to survive, create knowledge, develop social technologies, you have to create different solutions for this reality that they will be different from those adopted for COVID-19 in the Northern Hemisphere, especially in Europe. We need to build for this particular reality of inequality countries such as Brazil and other Southern Hemisphere countries. We only learn and develop such social technologies in these vulnerable realities if their community leaders and ways of organizing themselves can participate in those decisions. The message, stay at home, does not have the same effectiveness in countries where housing and income conditions are so different. In countries like Brazil, the message has to be stay in a protected community. The way to protect it still needs to be developed. In this sense, monitoring technologies, modalities of distance teaching, access to fast and sustainable internet, technologies that quickly expand access to clean waters, those new solutions are demanded for everything in those communities. As my suggestion of any project, including therapeutic essays and clinical trials, must have a strong participation and trying to mobilizing the organizations of these communities. I can say that it's how I learned in malaria control experience in the region, in the Amazon region, for example. The third challenge, I'd say that if it's true that Brazil faces serious political instability of the national message of how to deal with COVID-19 pandemic, it's true also that local and regional governments have approached scientific specialized and trying to follow the recommendations of the World Health Organization. And that you have to know that the most part, the most proportion of the health system management, particularly the public health system network, is from the local and regional government. Those that are open hospital, expand testings, hire professionals, organize network monitoring of signs and symptoms, use technologies applications. So I would suggest that reinforce the partnership with local government. I'm showing here the Northeast governors, state governors consortium, but I can show the state of São Paulo government initiatives, South states initiatives. So I would suggest that more partnership with the local governments. The fourth challenge, I talk about the primary care as Dorothy has addressed it to us. Brazil has the hospital network absolutely compromised by COVID-19 at this moment. But Brazil still use little the large network of primary care healthcare that covers today about 70% of the population, that have thousands of professionals and health agents in those communities, in vulnerable communities, very strongly connected with the territories, with vulnerable territories. They know who are the vulnerable population. They know the patients with comorbidities, the patients that are at risk. They know the reality of people, how they live. This large primary attention network in Brazil today lacks clear guidance of what they can do, what they should do. They are without any strong equipment and technology that allow them how to contact those severe patients. They have no equipment that can help them to identify signs of early warning of evolution about to severe case. They have no protective equipment for health workers. And those professionals at healthcare management, at primary care management, they are linked to the local government. The local government manages the primary care in Brazil. So I really think that's a great support to the primary care in Brazil, particularly the health agents, family, community, medical doctors can strengthen the Brazilian response at this moment of the pandemic. The fifth challenge, I would say that Brazilian national government has not prepared the greatly expand of Brazil testing capacity. We are low testing country at this moment. This expansion nowadays is limited by the difficulty of acquiring test kits in international market. And this demand is still growing in Brazil. It's limited also by the training of professionals and researchers to develop and analyze test kits. Although this capacity is driven by the national government, the regional governments, particularly local governments and the state governments, and some of them very big state governments, like the managing scales of 40 to 50 million inhabitants, for example, as São Paulo state, as the Northeast, they care of 40 to 50 million inhabitants. They have the interest to try to stimulate a wide public and private network to promote, to develop more testing, to promote wide testing policies in the regions, trying to expand in testing. Those local governments, they need partners who can contribute with kits, offering kits, buying, selling kits to the local government, and how they can have some partnership to training professionals. They are supporting public and private universities, pharmaceutical industry, private laboratories to try to expand, to increase the testing capacity of this local government. And I think that they can mobilize more laboratories of public and private health network. Some governments or cities or in cities or states have managed to expand their testing capacity in actions like partnerships with university, but they still need more robust partnership that can increase the kits of tests, training of people. So I think it would be very interesting partnership possibility. And I think this, the last one, as Otavio has already addressed, Brazil has today more than 300 research projects in course in Brazil related to COVID-19. Almost 100 of them are clinical trials, prospecting for vaccine development. Most of them are epidemiological studies. all those studies are registered in the National Ethics and Research Commission. It's a national commission linked to the Ministry of Health. The Coalizão studies, as Otavio presented, are linked. Those studies are registered. It's the National Ethics and Research Commission. Unfortunately, due to the extension and severity of COVID-19 in Brazil, unfortunately, will be a lot of need and also opportunities for scientific research. And it's possible to have a detailed diagnosis of those research groups, their experience and capabilities through the data of this commission. So I would suggest a strong partnership of the Chinese colleagues, IBRACHINA with this National and Ethic Research Commission in Brazil. And at the end, I'd like to thank the opportunity and be available to our colleagues if you have any question. I try to point out here what I would say is nowadays the scenario of current reality, but also the scenarios of possible partnership to be developed that can reduce the suffering of the Brazilian people and try to accumulate knowledge and experience between Brazil and China. Thank you a lot, and I will be available to our colleagues.
Thank you, Minister Padilha. A very clear and scientific lecture. And at this point, Thomas, how about we open for a few questions that have been posted on the Zoom. I have one. It says, how can the conclusions from science be shared in a simple way to the lay public? And in which way the lessons from China in terms of science education could be promptly applied in Brazil? So I guess this question is for all the doctors. I don't know if we can start with Dr. Chen, because he was also asked in the group chat about quarantine, because in the news is that students are going back to class in China, and also some methods of treatment about hydroxychloroquine. Is it being used in China or not? And there is a final question also, I guess it can be addressed by all the doctors. Thomas, is related to the stem cell treatment, and is it available in Brazil now? So, Thomas, that's on my side. How about you on your side?
Actually, Anna, do you have any question?
Okay, so we let the doctors go. Hopefully, we start with Dr. Chen.
Okay. Question. For what question, Hector?
There are several questions, and perhaps the first one is about the possibility of the stem cells treatment being available in Brazil. And the other one is about quarantine and the relaxing of quarantine and the hydroxychloroquine treatment. Basically, these three.
I saw somebody asking for Sao Paulo, if Sao Paulo can release the quarantine regulation. I said, I don't think, because even in China right now, it's not relaxed yet. But I think test the total population of the Sao Paulo is possible, because Wuhan has 10 million people there, only using 10 days to test whole population, then they get a very good result. And to the Hector last night, the result, it's very good. Only after that you can decide if or not relaxing the quarantine regulations in Sao Paulo, because I think Sao Paulo the people less.
Sorry. So something I think was very interesting is how they were able to test massively here in China. So they did more than 1 million tests in one day, and
right.
The way they
So-
did it was grouping people into groups of 50. So the 50 samples.
No,
were all
they actually
together.
grouping people
to
5 to
check and
10, not 50. They're grouping people 5 to 10 together, not 50. 50 that's reported by the German research. So actually in Wuhan they group people 10 together. So they did it in 10 days for 10 million people. It's amazing. But that's that's not new way. It's for those blood bank, they're using that all the time, but not for the academic research. But it's okay.
Thank you, Dr. Chen. Dr. Padilla, Dr. Octavio, maybe a final comment. I don't know, Thomas, how about our time? And again, we would like to thank all of you for this great effort, volunteering your time to share these experiences that I know will save many lives. And also, go ahead, Thomas.
Yeah, we have 10 minutes to end the meeting.
Okay,
And
so we will ask each doctor for a final reflection and maybe recommendations. And before that, we'd like to thank also Casal Catalá and the Brazil Bar Association for broadcasting this, allowing thousands of people all over the world. Thank you so much. IBRACHINA and Beijing Language and Culture University, where I'm a professor, and we have a group of professors and students that have been volunteering to make this a reality. So let's start with, I guess, Dorothy, and then we go Octavio, and we will finish again with Minister Padilla with the final comments.
So my advice to everyone is, I think what I have learned as well is that it's most important to take care of ourselves first so we can take care of others. So we must sleep, we must eat well, and control any stress that we may have in our own lives. And this way we'll be able to help others best. So if there's any issue in your own personal health that you haven't addressed, please give yourself time for self-care, because this is a time, I think, when everyone suffers burnout, including myself. So I must say my last weeks at work have been busy as patients start to come back and we still have restricted hours. So I was staying 2-3 hours at work after I was supposed to go home, and this was causing me great stress. But then I realized that it's very important to take care of my own health. And the way I did this was by resilience. So finding ways to be flexible and changing the way I think. So I think it's very important to change the way we think. Sometimes we think that there's no other way to do things, but if we're open-minded, then we can be flexible under any situation and just adapt. As times go on, I think we'll be able to adapt to more and more changes if we're flexible.
Thank you, Dorothy. And I'd like also now ask...
and I've been so happy to see all of you work together in this.
Thank you, Dorothy. I'll ask Dr. Octavio. I'm from Guayaquil, Ecuador, and in Latin America, we know that Hospital Albert Einstein is the most prestigious one in Latin America. So it's a great honor, Octavio. Please, your comments.
Thank you. No, the honor is just mine, and I think I learned a lot. Was congratulations, all great presentations, great points. I think my final message will be, we should never forget the pathway of science. We should never forget the pathway of sound research in terms of medications, and even in terms of these measures, they should be guided by sound information, by sound data. And I think that's the way we should move forward. And the scientific community, I think, should more and more unite. I think it will be great to exchange, to enhance the exchange between Brazilian and Chinese scientists and also from scientists from other countries. So I think my final message has to do with science. The pathway of science, the pathway of sound data is the way to get us out of this crisis. So that's, I think, that it's my final message. Thank you.
Thank you, Octavio. I guess Dr. Chan, with your final message, and we will conclude with Minister Padilla, and of course, with Thomas, who had been key in letting us have this encounter. Go ahead, Mike.
Thank you very much. Very nice to meet all of you. Actually, I visited Brazil many times early this century, working with the University of São Paulo. I hope we can promote the stem cell or immune cell in a Latin American country to actually the stem cell immune cell, not just for COVID-19, for many, many other hard to cure disease. So that's what I'm doing in China. So now every day. So hope we can get some cooperate. Thank you very much.
Thank you, Dr. Mike Chen. And Minister Padilla, what a great honor. Your information and your lecture has been so deep into the reality of the situation in Brazil. Thank you so much. Please, your final comments.
Thank you very much, Hector. I would like to say thanks to Dr. Law from the IBRACHINA, the Brazil and China Institute. And thank you very much for the lectures. I learned them a lot, and I'm very stimulated to try to learn and to share experience. And I think that Dr. Chen has addressed the big challenge in Brazil about the surveillance of the pandemic today. It's the big challenge that Brazil have too few tests. We at this moment we are just testing 4,000 tests per million people. So it's a very low testing country, and it's the biggest challenge to try to plan opening activities, stopping quarantine without testing. As I told you, the biggest national serological research in Brazil showed to us that just 3% of the people is infected in São Paulo, for example. How can we plan to reopening activities with such a low proportion of people infected and without great progression of case that we are facing in Brazil? So thanks a lot, and I wish that we can continue sharing experience. And thanks a lot for the IBRACHINA and all colleagues.
Thank you, dear Minister Padilla. And now, Thomas, thank you so much. From Beijing Language and Culture University, China Latin American Center, and in the name of our chairman, Professor Ma, please, your final words to conclude this important conference.
Thank you, Hector. I want to congratulate all the speakers and their presentations. It was very interesting to hear about the sharing experiences in China and also in Brazil. And I want to thank Dr. Luis Eduardo Vidal. He is a friend. He also helped on this organization. And also thank the Brazilian Bar Association here in Brasilia with the president, Felipe Santa Cruz. That is, he's helping us also organizing these events, international events, more specific about Chinese and the Brazilian relations. So I want to thank also the Bar Association here in Brasilia. Thank you, everybody.